So my first colposcopy experience was definitely not reassuring. I was brought into the room. It was the first time that I was working, that I had this physician. I was seeing a nurse practitioner before, so off the bat I was not as comfortable as I normally am with my provider, and I was definitely nervous. There wasn't a lot of background given to me before the procedure. And I had the procedure done. It didn't really get much better from my perspective because the physician seemed unsure. She was saying things like, you know, it looks okay, I think. I'm not really sure. It's hard to tell with these procedures. You're so young. And so I definitely was pretty uncomfortable throughout the duration. My experience with DYSIS was very different from my initial experience with colposcopy, primarily because I really understood what was going on the entire time. Of course, I have some background knowledge on the procedure itself, but my physician took me into the procedure room and made it a point to really explain what he was going to be doing. He also used the machine to really talk me through what was going to be happening. And throughout the entire procedure, he made sure to point out areas of concern and to really educate me on what was going on throughout. And when he took the biopsies, he didn't seem unsure. He seemed like, you know, those were the exact spots that he needed to take a biopsy of, and I'm certainly glad he did. So thanks to the DYSIS colposcope and my physician, the map was able to highlight areas for the physician to take biopsies of, and based off of the biopsies he took, we were able to understand that I actually had high-grade dysplasia even though my pap was completely normal. After my colposcopy results came back, I did have to go for a LEEP procedure, which I was certainly nervous about, but after talking it through with my physician, we decided that it was the best decision for me. And I'm very glad that we did make that decision because my LEEP actually showed that I had a significant amount of CIN3, which coming from having a normal pap smear is certainly concerning. So I feel so much better now that it's all been taken care of. My advice for women going through this is don't settle. Your health is too important, and unfortunately my family has experienced that firsthand. Make sure that you demand the best care out there and educate yourself. There is a better way than just having someone guess at your pap smear and your colposcopy. So do the research, and I obviously recommend DYSIS because of my decision and my experience.